Bangor Public Health officials are raising concerns now following a recent letter from the Maine CDC stating that it will be taking over the organization's nursing services.
Maine CDC officials say the decision was made to better serve patients statewide, but staff at Bangor Public Health fear they won't be able to provide the same services. News Center Maine's Drew Peters has the details.
Bangor Public Health's nurses have been bringing prenatal and postpartum care to the homes of families in the Bangor area for the past 15 years.
Lactation support, health assessments, educating them on all kinds of things like home safety.
But with the Maine CDC planning to have its own public health nurses take over duties by the end of September, they're worried those services may be changing.
It is hard to think of a group of nurses coming into an infrastructure that we took decades to build.
In a letter sent to the city, Maine CDC officials say the decision was made to better balance the capacity of public health nurses and more effectively address regional needs. Bangor Public Health officials say they don't doubt the skill and dedication of the CDC's public health nurses, but they feel they may be stretched too thin to provide the same quality of care.
It is going to take time for them to build the relationships in the community, build the relationship with partners, to understand where the resources are.
The acquisition is something Senator Joe Baldacci says comes at a time where Bangor Public Health needs as much resources as ever as the city faces an HIV outbreak and birthing centers throughout Maine close.
And it will disrupt services, lay off people, and generally not be good for the public health of the area.
Despite these concerns, officials with the Maine CDC state in the letter that there will be no disruption to patient services and are proposing a public health infrastructure grant that would allow the city's nurses to address other community issues. Something surrounding health organizations like Wabanaki Public Health and Wellness are optimistic about.
I know both of the leaderships and believe in their ability to work together to build something perhaps even better than what was before.
That collaboration is what staff at Bangor Public Health and Wellness are hoping they can work on with the Maine CDC as it takes over services.
Because we have valuable relationships, valuable knowledge, valuable skill.
In Bangor, Drew Peters, News Center Maine.
Bangor Public Health officials and Senator Baldacci will be meeting with the Maine CDC and Governor Janet Mills next week to further discuss these changes.